Hello and welcome to episode 6 of the Lister webinar series for COVID-19. I'm Alexandra Gates. I'm a senior respiratory physiotherapist here at the Lister Hospital, and today I'm going to be talking to you about the active cycle of breathing techniques. So these are a group of breathing exercises with the aim of loosening and moving sputum from the lungs, and they're particularly advised for those that have wet productive coughs. They are predominantly used with the patient groups that have bronchiectasis and COPD. However, aspects of these breathing exercises might be useful for those with COVID-19, particularly to help with their breathing control and lung expansion. They can be repeated numerous times a day, particularly during the exacerbation, and for up to around 10 minutes at a time. These can be utilised alongside exercise, and we often recommend that patients use them as a self-management tool also. The exercises are split into 3 parts. So initially you have your breathing control, which helps to relax small airways. You then move on to deep breathing, so that's thoracic expansion with the view to increasing your lung volume and moving air behind the secretions. And the final aspect is huffing, so that's either a small long huff to try and clear mucus from the lower parts of the lungs, or a big short huff to clear secretions that sit higher up. I'm now going to show you a video of me demonstrating these techniques.
So I'm just going to run through the active cycle breathing technique, also known as ACBT, which consists of breathing control, thoracic expansion, and huffing and puffing, which is a full respiratory technique. This can be useful for patients that have got productive cough and need help to clear secretions. So Joe, what I'd like to do to begin with is just use breathing control. So slow breath in through your nose and out through your mouth. Your hands will just try to expand at the bases and just try to relax the smaller airways. Going to repeat that 4 times. Then we're going to move on to thoracic expansion. The idea is to get some air behind the secretions to help repel them out and improve the lung volume. So what I would like you to do is put your hands on your lower ribs. Take a slow breath in through your nose. A big sniff when you get to your maximum expansion, and then bring out through your mouth. And then repeat that up to 4 times. If you start to feel a little bit dizzy, I want you to go back to the breathing control. Excellent. What we're going to do is try and get rid of those secretions now. So what I'd like you to do is to do long, slow breath in through your nose, and then a huff out. So it will take a little bit longer this time. Just try to move the secretions that are lower down. Once you've got the secretions moved up higher, you can take a practice with a faster breath in through your nose, and then a bigger huff out as well. And if you find that doesn't quite move the secretions, it's like just do a normal strong cough just to try and clear it. And if you find that you get a little bit short of breath in this position on which you lean forward and sit onto your arms, just to offload the diaphragm, support your shoulders, and improve your expansion. Patients that have got a non-productive cough, they might find that the thoracic expansion and breathing control is really useful, but the cough on the top might cause a bit of irritation, so I would avoid that if you've got sort of like reactive airways.
So I just want to explain each section a little bit more. So breathing control, which is breathing gently with as little effort as possible just to relax your airways. So what we recommend is breathing in and out through your nose as you get some natural humidification. And for those that find it useful, we also sometimes encourage pursed lip breathing, which is sort of breathing out against closed lips, just to slow the breath down. If people find that during the ACBT cycle they get a little bit short of breath or they find it quite difficult, we always recommend reverting back to breathing control. The next section is called thoracic expansion, also known as deep breathing. So we recommend taking a long, slow breath in through the nose, so more humidified air, aiming to keep the chest and shoulders nice and relaxed. We recommend that holding this on the breath in for a few seconds at a time, or taking a big sniff just to maximize the expansion, and then breathing back out through their mouth. We recommend repeating this for 3 to 5 breaths. If you find that the person completing the exercises is getting a little bit dizzy or lightheaded, we just recommend reverting back to the breathing control. The final stage of ACBT is a huff, which sometimes requires a cough after. So it's exhalation through an open mouth. It helps to move sputum to the proximal airways. The aim of it is to try and replicate misting up a mirror or a glass. And there are 2 types of huff. So you have the small long huff, which will move sputum from lower down in your chest. So we recommend taking a small to medium breath in, then squeeze the air through your lungs. Squeeze the air from your lungs until they feel empty. And then you have the big short huff, which will move sputum from higher up in the chest. Use this huff when the sputum feels ready to come out. So some people will find that they can hear crackles on the breath out, and that's an indication that sputum is ready to clear. If the huff itself doesn't quite clear the sputum, then we recommend following it up with a cough. If you find that your airway is wheezy or irritated, then we recommend just stopping the huff or the cough and reversing back to breathing control. So some considerations for COVID-19. So I just want to say that these breathing exercises are widely used and they weren't created solely for COVID-19, but there are aspects of it that might be useful for our patients. So we recommend that patients don't take deep breaths in through their mouth because that air is not humidified, it's very dry and can be very irritable and exacerbate the cough itself. We recommend breathing in through the nose, utilising that natural humidification. Some patients that are quite short of breath will find just the breathing control aspect of it really, really useful to help them preserve energy, because we know in these patient groups that they can become quite fatigued. ACBT might be appropriate for patients that do have a productive cough. So we do know that some people with COVID-19 do end up with retained and excess secretions. So once again, I just recommend breathing in through the nose, out through the mouth, and avoiding any deep breathing through the mouth in particular. It's really important to think about our populations of patients that are quite breathless, because these are often exacerbated by our daily activities. And for some people, they find they're extremely breathless at rest, which can be very scary, and often anxiety can drive that even further. We encourage breathing control with these patients, so in through the nose, out through the mouth, nice and slowly with pursed lips, as though they were going to blow out a candle or whistle. There are particular positions that would be really, really useful for patients who find that they're getting quite short of breath, either during activity or at rest. You'll see on the slides below, there's numerous positions that can be extremely useful, and the person should utilize the position that's most comfortable for them. These positions help to optimize the diaphragm by offloading it, and they also help to fix the shoulders and other accessory muscles in order to allow the ribs to be pulled and air to be drawn in. Some patients will find that even in these positions they're quite breathless, so we just recommend that they kind of persevere as much as possible to find a comfortable position to ease their breathing, and then they might also find that they can complete their breathing exercises more effectively once they're comfortable and they've utilised a position that's best for them. Below are the handouts from the Association of Chartered Physiotherapists in Respiratory Care. These can be really useful handouts to give to individual patients so they can read through the exercises themselves and familiarise themselves with them. As physiotherapists, we also hand these out on the wards to patients where it's appropriate. So if you have any patients you think would really benefit from this education, please don't forget to refer to us, because we're really, really useful profession and tool for these patients. I'm just going to move on. Please feel free to contact me directly or through my extension number 4924 if you have any questions at all. This is quite generic information that's useful for lots of patient groups, so if you have any questions at all, please let me know. Thank you very much for listening. I really appreciate your time.